Hi, I'm Eric.
Hi, I'm Addie.
Alright. Hi, you guys. I'm Lulu. Have you ever experienced or seen someone have a seizure before? I personally have never seen it, and I think I'd probably freak out if I ever had one. I'm usually the one on the other end of the spectrum having the seizure, freaking everyone out. My seizure started when I was 16 years old. I'm now 27, and I continue to have them on a daily basis. It's actually more common than most people believe. According to Mayo Clinic, 10% of the people with seizures have juvenile myoclonic seizures, which is one of the main leading causes of seizure disorders. There are several more causes of seizures. Um, the first one is due to alcohol or drug abuse. There is also you're born with it, neurological disorders such as cerebral palsy, and there's also head trauma or brain trauma to the head that could also cause seizures. There are different types of medications for seizures. There's things such as Lamictal, Depakote, Tegretol, and Keppra. All of these medications are no guarantee that they will actually completely take away your seizures. It's just to reduce them temporarily or to have them less frequently. They do have a lot of side effects. Some of the side effects of these medications are memory loss, depression, weight gain, which is one why I do not take this medication, suicidal thoughts, deja vu feeling, and an overall feeling of strangeness. There are all different types of seizures as well, such as grand mal seizures, which are the ones that everyone thinks of when they think of seizures. These are the ones that are full blown body twitching with foaming of the mouth, body shaking. There are also petite mal seizures. Petite mal seizures are the ones that I have. They're slight twitching, slight movement. They only last for a few minutes. And there's something like the grand mal seizure, it's just a little bit reduced. There's also the absent seizures. Absent seizures are the one that usually happen to children among the ages of 12, 13, 14, up until the middle age of the 21s. These seizures are usually just blank, staring off. You actually don't lose consciousness as you would a grand mal seizure or a petite seizure, and usually the person having it doesn't even notice, along with the person who's around them. Some people don't even notice. Um, these seizures are very common as well as the juvenile myoclonic seizures. In fact, 10%, according to um, the Epilepsy Foundation, 10% of the world has seizures at one point in their life, whether it's just one time and it never happens again, or reoccurrent seizures that may go long periods of time without having one and then all of a sudden having one month. My seizures are all the time. I refuse to take any medication due to the side effects. There are other ways of treating seizures due to devices. There are devices that can be put into the brain. It works by finding the electrical impulses that go off in your head. They find them and they remove them. There are also surgery that you can go through where they put a device in your head and the device actually sends electrical impulses to your brain so they could eliminate the erratical impulses. I chose not to go with those methods either. Surgery is a little extreme for me. I prefer to deal with my own seizures on my own. I personally think that just letting the world know more about seizures and what is causing the seizures and how to treat them, then maybe when I go out in public and when someone else sees someone having a seizure, they're more known People know how they happen and how they're treated, and it's not as uncommon as people may think. This would allow me to go out more and not be so scared of people seeing me have a seizure and freaking out. I think spreading awareness is more important so that everyone knows a little bit more about my condition. Thanks, everyone.
Still here, still here.